Hi everyone. Today's video will look at Achilles tendonitis and the correct progression for eccentric strengthening exercises. Now, everyone knows the gold standard exercise for the rehabilitation of Achilles tendonitis is eccentric exercises. If it's done correctly, you'll notice you'll reap the results much more faster and you'll be able to get back into your activities and sports as much as possible. Now, if this is the first time you're hearing the word eccentric, here's a small explanation of what eccentric strengthening is all about. Now, there are two types of contractions where a muscle can be strengthened. One is concentric contraction and the other one is eccentric contraction. Now, for any issues related to tendons, not muscles, eccentric exercises are gold standard. Now, here's a quick difference between the two. Okay? Now, I got a free weight in my hand. Dumbbells. Now, when I'm going to use these dumbbells to raise the dumbbells against gravity and perform flexion of elbow, now you notice my biceps have contracted and it's shortened, performing concentric exercise. And when I'm slowly lowering the weight, the same biceps, I can feel a lot of tension. Now it's lengthening and contracting at the same time, lowering the weight. Triceps did not do anything at this point because they are antagonist muscles. So once again, against gravity, biceps shortens, concentric. Lowering the weight, same biceps lengthens eccentrically, and there's a lot of tension builds up as well. We're going to apply the same concept for strengthening the Achilles tendon area and the surrounding muscles of the Achilles tendon. There are three muscles in that area. You got gastrocnemius, you got soleus, and you got plantaris. So all these three, they merge together and they form the tendon at the back of your heel. It's right here. That's where your tendon is, right there. Okay. Now let's go into the progression of exercises. I've noticed most therapists, when they recommend exercises for Achilles tendonitis, they right away ask a lot of clients and patients to perform these exercises at the edge of the steps, taking all the weight and lowering the body down. I mean, those are great at the end of your rehabilitation period. But at the beginning stages, it's very important to perform exercises without taking the weight. They're divided into two areas. One is open chain exercise. The other one is a closed chain exercise. Open chain kinetic exercises are exercises where you don't take the weight, but you'll still strengthen the muscles by using weights and bands. Okay, so here's an example. I have an elastic band, also called TheraBand. There are different colors with resistance. Now, to perform an eccentric exercise using a band for your Achilles tendon area, this is how you do it. Okay, let's put the leg all the way up, assuming my right leg is the one which is in trouble, where I have pain at the bottom of the heel, just above the heel at the tendon area. Now, keep in mind, just as an example, I'm going to wrap this band around my heels and I'm going to create some tension right there. Now, let's perform how to do a concentric and an eccentric for the calf muscle area. Now, when you perform plantar flexion with a lot of tension in the band, you notice the muscles at the back of my calf have gone smaller. That's concentric. Now, I slowly bring the leg back. The same muscle at the back is lengthening and it's causing a lot of contraction. Now, as I mentioned, for your Achilles tendonitis issue, you only need eccentric. So how do we do that? Take a look here. Now, to perform that, you cannot perform plantar flexion with tension. So I'm going to start with releasing the tension and perform the plantar flexion with the no tension. Then I'm going to pull back on the band and create a lot of tension and slowly bring the leg back with a lot of load. Now, I just performed eccentric strengthening only. Now, once again, I'm going to release the tension. I'm going to perform plantar flexion with no tension, so which means there is no concentric with load. Now, I'm going to pull the band and slowly bring the leg back, creating an eccentric strengthening for the gastrocnemius area and the Achilles tendon. Is that clear? All right, so here's the next progression. So from open kinetic chain, now we are moving on to closed kinetic chain. So both feet planted on the floor. I'm going to hold on to the wall for extra support. Now remember once again, when you are standing, when you're performing both concentric and eccentric, this is how it goes. So when you go up, this is considered concentric for your gastrocnemius muscle, and then when you lower the weight, this is considered eccentric. So what do we need is only eccentric. So this is how we're going to perform. So this is done with your knees straight, and we're going to progress by keeping the knees bent. All right, so let's do this one step at a time. Now, assuming my right leg is the troublesome one, so remember, I am not going up with the right leg. So watch carefully. I'm going to lift my right leg. I'm going to go up with my left. Then I'm going to bring my right leg and I'm going to slowly lower the weight by equally taking weight on both legs. Once again, lift my right, go up only with the good leg, then make sure the toes are pointed down and come down with both legs together. Now we're going to do the same thing this time. We're going to go up and we're going to point it, knees bent, and we're going to slowly lower it down. So that's the next progression. So once again, you're going to go up, point with the toes, knees bend, and slowly lower with both legs. Now once again, these are done at least 15 times. We call 15 repetitions, at least 2 to 3 sets. We're talking about the same elastic band. You can maintain the same repetitions and sets. Okay? Now, from here, we're going to the next progression. So watch carefully. So this time we're going to go lift this leg. We're going to go up and we are going to only come down with the affected leg. So once again, going up with the good leg and point it down, lift the good leg and come down only with the affected. So that's the next progression. One more time. Go up with the good, point the affected, lift the good one, come down with the affected. And then moving on to the knees bend, which will work on with the soleus muscle. So once again, watch carefully. Go up with the good, point the affected, bend the knees and come down. All the way down. So one more time. Go up with the good, point the affected leg, bend the knees and come down with the affected leg. So that's the next progression on this one. All right. So this is the last difficult progression for eccentric strengthening for Achilles tendonitis. Now you can do this at the edge of the steps, or if you can find anything which looks like a step, which is not too tall, it should be at the same length as a normal step length or the height. So make sure you find something like that. Hold on to a wall or a handrail for extra support when you're doing this, so you can slowly release the support depending on how much pain or difficulty you may have. All right. So one more time, it's always a good idea to go with the good leg up. All right. So this is my starting position at the edge. So one more time, I'm going to lift the good or the affected, my mistake. I'm going to go up with the good, point, and I'm going to drop both heels a little bit down to the edge of the step. So once again, remove the affected leg, go up with the good leg, point with the affected, and come down with both ankles together. Now the next progression, to make this a little more difficult, I'm going to lift the affected, I'm going to go up with the good, point with the affected, and then lift the good one and only come down with the affected. And then bring the good leg back and go all the way up, and then point the affected, and then lift the good leg and come down with the affected ankle. We're going to do the same thing with the knees bent, right? So we're going to go up and point, bend the knees, and we're going to come all the way down. All right, one more time. We're going to go up, point, bend the knees, come all the way down. Here's the difficult progression again. We're going to go up, point the affected, lift the good leg, bend the knees, and come all the way down. So that's the last progression of this exercise. All right, make sure to do these exercises very gradually, starting from the open kinematic chain using those elastic band, and then progress to standing with both foot, and then moving on to the edge of the step, and finally completing with a single leg drop, the affected leg. Now remember, do not go beyond the limits of pain. If anything is causing more pain at the end, make sure you reduce the numbers of repetitions or the sets. Pace yourself accordingly, right? So do not push more than what you can do. It's also important to aim for 15 repetitions to a maximum of 2 to 3 sets. All right. So good luck with your rehabilitation related to Achilles tendonitis, also known as Achilles tendinopathy. See you guys.